Okay, welcome back. How are you today, Grazel?
I'm doing well, Scott. How are you?
Yeah, pretty good. Doing a little bit of Googling and I came across this question and it kind of stumped me because I feel like there's two answers to it. Is it okay for a therapist to tell you to leave your partner?
It's a very tricky question, and I can understand why you would find people asking this question online. First and foremost, I want to talk about our ethical duty. We have an ethical duty to our patients, and that's the first thing that we need to always look into is that what is ethical and whatever we're sharing to the patient, is this to the best interest of the patient?
Mhm.
So I don't, for me, I don't do that. I don't tell my clients to leave their partner.
Mm.
I tell them, I work with them about the risks and benefits of staying in a relationship that's no longer helping them.
Mm.
I think the decision to leave their partner is their decision, not mine.
Yeah.
So I would, uh, if you ask me directly, can a therapist tell you to leave their partner? To me, I would say that's not an answer I can answer for you, or that's not a question I can answer for you.
Mm.
However, I can help explore what's going on in your relationship. Are you questioning your relationship? What's happening? Is it feeling toxic? Is it feeling unhealthy?
Mm.
What issues are coming up for you, right? Now, if it's going into a place of my patient is no longer safe in the relationship, then I'm going to talk about the risks to my patient's safety
Mm.
versus telling my patient, you need to leave this partnership that you're in because it's not healthy. Um,
Yeah,
yeah.
I don't know if it's a Hollywood thing, things people have seen in movies or on TV, but there's sometimes this impression that a therapist is there to tell you what to do. And certainly in my own therapy journey, it was very surprising when a therapist was just asking questions and helping me work out what to do rather than telling me this is what you should do. Um, I don't know. What do you think? Where does that idea come from?
Well, I think part of our job too is to make sure that we're providing psychoeducation about what a person needs to do because sometimes you don't know how to move forward with things. So that's part of our work too, and that's also ethical is that there's moments when I have to tell you exactly what needs to be done for your own safety and to the best interest of you. But that's a case by case situation and it depends on what the question is, right? So it's not this question is I can answer this question in very different ways, right? So if somebody asks me, do I what should I do? I want to leave my marriage.
Mm.
I say, okay, well, I think it's really important. So I would tell them, I think it's really important for you to look at what are the things that you and your partner have done to see whether you can save this marriage or not.
Mm.
And is that worth talking about with your partner before you go towards separation or divorce or leaving your partnership? That I will tell you, but I will not tell you, yes, you should leave.
Yeah.
Does that make, I'm trying to discern
Yeah.
the difference for you, right?
No,
Does that make sense?
that makes perfect sense. It's absolutely right. So how do you really support your clients when one person is kind of leaning out, the other person's leaning in? What do you do to support each of them?
Yeah, I definitely talk about how different their agendas are, that one person is wanting to stay and another person is wanting to leave. And how do we come to a place where there's understanding about how different their paths are, right? And how do I help them separate amicably in those moments, right? Because it's really important that couples are able to understand that this is no longer working for one person, but I'm also very careful at it's not our job to align with one partner versus another. We have to be very um, neutral
Mm.
in addressing two couples that are separating, or I mean, two partners that are separating. So what I would usually say is that let's talk about what got you here. Let's process the issues that got you to a place of questioning whether you want to stay in the relationship, and how real is this for you? And is it reconcilable?
Mm.
And if it is, what do you both need to do? What are you both willing to do? Right? So their answers to those questions is going to give me a path on how to guide them further in our work together.
Yeah, that makes sense. So how can you explore separation in a kind of healthy, respectful way, particularly when you're in that kind of mixed agenda scenario? Um, because I imagine there's a lot of emotion in that situation. How do you kind of hold that space and help them explore that in a healthy way?
It's very different. I mean, it really understanding who the couple is, understanding what skills they have to be able to talk about something really sensitive, understanding their window of tolerance to be able to take the differences between the two of them. So I have to make sure that I have skills to provide when we're discussing topics that are very hard in the room, where if one partner gets dysregulated emotionally, that I'm there to be able to help them regulate, because it's really hard when when couples are separating. Breakups are shitty for a lot of people, right? They're not they, they don't like it. It's really difficult. Even for therapists, it's really difficult, especially for couples therapists like me, right? I'm there to make sure that you're sharing the love that you've wanted to share with each other. So when I see you break up, I feel sad with them. So it's really important to understand, who am I sitting with? What are they able to receive? And if they're able to receive something really difficult to receive, what skills do they have to take care of themselves so that I can help them talk about separation in an amicable way?
Yeah, and I guess you probably have a sense of this couple could be could come back together. This couple, it probably is best for them to separate. But obviously, as the therapist, it's not ethical for you to guide them in any particular direction. You just need to help them work out what's best for them. So, how do you stop your own biases kind of influencing your questioning and influencing how you're working with the couple?
So, couples therapists that have training, again, additional training in treating couples that are separating, which is discernment counselors. Um, they teach you how to work with your own biases in those moments. They make sure that you're working on yourself in your own therapy. You're seeking additional therapist consultation or supervisor consultation to help you um, be neutral in your work with the couple.
Mhm.
So that's the therapist's work. That's the self of the therapist's work. Now, for therapists that doesn't have training in discernment counseling, there might be implicit biases that may come in the room. So again, I advise that if you're a couple going through separation, look for somebody who has advanced training in discernment counseling and in couples therapy. It will be beneficial to you. I can't say that. I can't highlight it and heighten it any more further.
Yeah. Yeah. I mean, you need to have that level of awareness of yourself, and that means you need to have done the work yourself in order to actually address that situation in a healthy way that's beneficial for the couple. Otherwise, you are just going to be putting your own stuff on other people, which it's not ethical, it's not right, and it's not to the benefit of the clients in front of you. So yeah, having that extra,
Yes.
making sure that your therapist has that extra training, has actually done the work themselves, really, really important. Absolutely. Um, yeah, thank you again so much for your time. It's always great talking to you, and we'll speak again soon.
Okay. Thanks, Scott.